So I wasn't involved, and I don't get involved in disciplinary procedures. I was involved in a meeting at the outcome of the initial investigation, which was with staff to try and calm the situation down and to explain how the process was going to evolve going forward. What we then decided to do is there was still a sentiment of unease with Unite and with staff, and it hadn't calmed down sufficiently to the extent that we wanted. So what we agreed to do, we agreed with Unite to look into the procedure that had been put in place. So we agreed with Unite some terms of reference to look into the disciplinary procedure and the HR management of the hospital, to put in place recommendations of how such disciplinary processes should be handled going forward. And when we say that we have recommendations on the procedure, on how to handle grievances and disciplinaries in the future.
So we haven't seen the report. Can you tell me a bit of what these recommendations are?
The recommendations are numerous, and the recommendations involve, how HR can handle this, how staff can handle this, how management can handle this, and it also contains recommendations on union involvement, etc. So it's quite a thorough report where the entire situation is reviewed, and it's effectively a look back exercise on how we can make the procedure more robust going forward.
So just to make it clear, this isn't because something happened at the CCU that this review has been carried out. This is just because people were unhappy on how the actual disciplinary procedure had been tackled.
Absolutely. It wasn't because of patient concerns that this review was done. What happened was that people were unhappy, staff were unhappy with the outcome of a disciplinary procedure, and therefore we agreed with Unite to do a look-back exercise on the way that the disciplinary process worked in the GHA. And again, as I said before, we agreed terms of reference with Unite on exactly what it was that we were looking back on, and now we have agreed with Unite that we will implement those recommendations.
What are the operational and cultural challenges that you mentioned in the statement?
So in the CCU there have been some issues for a couple of years now, and it all came to the fore with some bullying allegations on one side and bullying allegations, counter-bullying allegations. So what we were doing, what the purpose of the report was, is to look at the way that the GHA HR and GHA management deal with these issues going forward and deal with disciplinaries arising from these issues going forward.
How redacted will the report be, and is it a question of just removing names so that people aren't identified?
So the report was shared with myself, with the GHA and with Unite simultaneously in an unredacted format. So Unite have the full report as was received by the GHA. So what has been agreed is that it's really an internal report for GHA workforce to identify the issues and to put to correct these issues. So for those reasons we have determined between ourselves and Unite and staff side not to publish the report.